With modern advances in troop body armament and battlefield medicine, the survival rates for our troops overseas is higher than it's ever been in history. 90% of those injured overseas can expect to survive, and that's great news. Here with us now, live in the studio through his webcam, is the Director of Field Services, Bo Rollins, for the Paralyzed Veterans of America. Now, Bo recently took a trip, or just a year ago, took a trip to Germany to visit a hospital where the troops, after being injured, can show up within hours after being hit. So Bo's here with us now. Bo, welcome to the show. How are you?
Thank you, Jan. It's a pleasure to be here.
Now, I just hinted to the audience about your trip to Germany. You took to Landstuhl Air Force Base there. Is that right?
Landstuhl Regional Medical Center and Ramstein Air Base, which are pretty close together.
Okay. Yes. Can you explain to us the reason for your trip and why it came about?
Yeah, I was initially I was contacted by Mrs. Timken, who's the wife of the U.S. ambassador to Germany, and she volunteers over at Landstuhl, and I had some questions and concerns about veterans benefits and how the system worked and so forth. And so ultimately she invited me over there, and I was able to arrange that through Paralyzed Veterans, and went over there and worked with the social workers and the chaplain staff to visit patients, and particularly families. They were mostly concentrated on those who are severely injured. So in a lot of cases, the patient was so wounded that they weren't able to speak for themselves. So many times I had to interact with the families.
Wow. So what was the goal behind your trip when you went over?
Well, number one, just kind of trying to get an understanding of what was happening over there, and then as I got there and got to working, then I basically kind of fell into a situation where I realized that our folks over there, our troops who've been injured, and the families who are brought over there when somebody's been horribly maimed, are really in the dark. They don't know what's going on. They don't know what's going to happen next. They don't know what to expect. They don't know what the systems are going to do for them or anything else. And so that inspired us to try to take a look and see how we could help.
Now, for your organization, what type of changes have you implemented, or what's changed since your trip there?
Well, we've been trying since our trip there. I came back, briefed my management team and our board of directors, and ultimately we were authorized and approved to go back over there and try to set up an office and provide services like Paralyzed Veterans provides throughout the country through our National Service Office program. Unfortunately, we've not been able to succeed in that. We've run into some typical bureaucratic hurdles in trying to get approval and so forth. And since we're not a government agency, we can't just bully our way in there.
Yeah.
So we are working at Walter Reed. We try to work with patients as soon as they get over here, but we would like to get involved even earlier, because the families, I mean, when you get a phone call at 2 o'clock in the morning that your son or daughter's been injured, and you have to get on a plane and go over there, you need somebody on the ground to talk to you and tell you what's going on and what's going to happen next.
No, for sure. I think just like we talked about with Rosie, I think it's easy for people to look back once they've been through that experience
Sure.
and say, well, this would have helped if it were in place. But it's pretty bold for your organization, and I think very commendable that you're trying to put things in place to say, hey, we've been there and we know where the road you're about to travel.
Yeah, and we're going to keep trying.
Good, good. What are some of the things that people here at home can do to I guess, aid in your efforts?
Well, like yourself, of course, Paralyzed Veterans has a website, www.pva.org. And if somebody chooses to support us, then they can go in there, look at our programs. If they wish to make a donation, that's great. We appreciate all the support. We are funded by the public, so we don't live off government money.
Yeah.
So we need funds to operate our offices and provide our services. But they can also do things locally. We have 34 chapters out there who are providing services at the local level. They can hook up with one of our chapters. All of them are listed on that website. They can contact that chapter and see about volunteer opportunities or what they can do in their local community, out there where the rubber meets the road.